Men are dying too young. 2 out of every 5 men are going to die prematurely. The alarm's raised and we need to do something about it. We just simply can't accept that as the status quo.
Welcome to the Dad Central Show, the podcast that helps overwhelmed dads conquer stress, build confidence, and become the father their family brags about. Join Drew Solon, a leadership coach and father of 5, and Ed Gow Jr., a fatherhood advocate and contributor to the Good Men Project, as we guide you through the journey of fatherhood. We'll show you how to connect deeply with your family, manage your time and energy better, and master tools to become the dad you want to be. Let's get started. What is up, everybody? It is Ed Gow Jr. from Dad Central, and a gentleman that's telling me that summer is here, but I don't see it on my calendar.
Oh man, Drew Solon of Dad Central. You know what? I see sun, I see leaves on the trees, and I naturally think, okay, it's summertime. I feel like I can go outside and enjoy myself. So yeah, you're right. Officially, what is summer? June 21st. So I'm early. You got me there, Ed.
Yeah. It's okay. It's okay. Well, you know, it's all good. It's all good. What's been going on in your world?
Well, we got Father's Day coming up this weekend as we're recording, and I'm supposed to be running a Spartan race, but unfortunately, I have an Achilles injury from a recent baseball game, so I'm gonna have to bow out of this Spartan race. But I'm gonna defer to October, so I'm coming back strong in the fall.
All right, good stuff.
That's the
Good
plan.
stuff. Well,
What's going on in your world?
Father's Day, and I think I had mentioned to our dad's group, I bought a book from my dad for Father's Day. And I won't give the story here because they're not promoting us. That basically it's a number of questions about his fatherhood journey and him writing answers down. So when he's finished, I can keep that as a memento of his fatherhood journey and impacting my fatherhood journey.
All right, we'll talk about that another time. I think that sounds pretty cool.
Yeah, it is. Well, I was on Instagram one of those few times and it came up in my feed. Maybe Instagram's listening to me. You never know with these bots. And it popped. I said, okay, hey, I'm going to buy it, and got it in one day. I said, all right, so I'm seeing you on Sunday and saying, this is my gift to you. And I know he'll be more than willing to write out that story. And you know what? Maybe in a future episode, I'll read some of the story for you and our audience. But let's get to business. Dad Central is a parenting podcast to reduce stress and build confidence in fatherhood. As always, our show is sponsored by Dove Men Plus Care. Dove Men Plus Care believes that care is the best of a man because when men care for themselves and others, there's a positive impact. So Drew has asked me to introduce this gentleman. Now, if I introduced him the way I wanted to, and it's not bad, you go, what? But we're going to be formal. Todd Minerson, country director of Movember, is joining us today. Country director for Movember Canada is with us today, and we're going to be talking about the real face of men's health at 2025 Canadian Report. What is up? I'm kind to you because I could have given you another intro. You know that.
That would be kind too. I would have loved that other intro, you know?
It's a good, okay. DJ Mofa. No, it's all right. We're having some fun. What is up, Todd? You been good?
I've been good. It's such a joy to talk to both of you guys. I know the work from Dad Central is always special, but I've been thinking a lot about you lately with Father's Day on the horizon, the good work that you're doing, and you know the support you've lent to us at Movember over the last couple of months as we have got ready for Men's Health Week also, which is kind of the prelude to Father's Day here in North America. So exciting times, and just super fun to be actually chit-chatting with both of you.
Excellent. I'm just going to start off with a first question, and then I know Drew has a number of them. So I just want to kick it off saying the report title is The Real Face of Men's Health. What does the title signify, and how was Movember's approach to men's health evolved over the past 2 decades to reveal the real face?
The real face. Yeah, I mean, for us, you probably know, and I'm sporting, I was joking with you guys beforehand, sporting a very rare June mustache for me. I came down, you know, about a week or two ago with this, and my wife and kids were like, what are you doing? It's not November. Why you got that thing on your face? It's not cookie duster season already. But as we say, you know, there's no such thing as a bad mustache for a good cause. And this idea of the real face of men's health is something that's really been close to our heart, you know, and as we try to understand really what is the state of men's health in Canada, In fact, we've released this report in Australia and the UK already, and it was our turn here in Canada to understand. Let's take a deep dive. Let's understand what that real face of men's health is. Let's dispel some of the myths, but actually raise some of the alarms that need to be raised. And actually, let's look at solutions and what's working as well. And that's kind of what's been behind it. And for people who are maybe kind of new to or a little bit familiar with Movember, we really are more than just the once a month, a year mustache event and the fun and frivolity of 50,000 Canadians raising funds and awareness for men's health. There is a passion and a drive and a commitment in our organization to help men live healthier, happier, longer lives. And at the heart of this report is that notion that you can't change what you can't measure. So let's measure it and let's understand what the problem is and the scope of it. And let's try to tackle it in conjunction and collaboration with, groups like Dad Central and others that care deeply about men and our wellness.
Yeah, I mean, Todd, certainly, I jokingly but seriously mentioned that, an injury. It's relatively minor, we'll say, when it comes to health outcomes. But, as a dad, as I'm aging, as a recent healthcare visit really showed me that, wow, I can't believe how much things are maybe not going the way I expected. And so, I mean, health is certainly important to me, and it has been from the time I was young. But as far as the big ideas that we should really be focusing on as a result of this report, what is it really telling us? That we should focus on?
Yeah, I mean, we commissioned a lot of original research. We had a few experts looking at the state of the world when it comes to premature mortality and things like that. We highlight dozens of really effective programs for working with men. We engaged with an Indigenous author and researcher named Negan Sinclair to help us bring an Indigenous perspective to the issue of men's health as well. But we have kind of 4 thematic takeaways, Drew, from what we found in the report. The first one raises the alarm a little bit, and it's just putting hard data to the fact that men are dying too young. 2 out of every 5 men are going to die prematurely. That means before the age of 75. Our lifespans as a Canadian man in this country are 4.5 years shorter than women. In real terms, in 2023, we lost 75,000 Canadian men dying prematurely for largely causes that are preventable. So the alarm's raised and we need to do something about it. We just simply can't accept that as the status quo. And it's not at the expense of other people's health and wellness either. It really is, and I'd love to chat more about this later. It is the tide that rises all of our boats. When dads and men are healthier, everybody benefits around us. The second thing that we found was that men are engaging with the healthcare system, but in a lot of ways it's not working for us. It's not really working very well for us. There are structural things like access and timeliness of care, but there are also response issues in the system that are not particularly helping men in the problems that they're trying to solve. And there are health behaviors that men ourselves are not probably ideally leading into when it comes to our care in the system. So we were looking at ways to try to find more gender responsive care for men and change men's health behaviors. So some of the alarming work that we've uncovered in the report are around men's health seeking behaviors. So most men, 65% of men, wait 6 or more days if they're experiencing a serious health symptom to go to the doctor. And on the other end of that spectrum, 1 in 10 men is going to wait 2 years before they see a doctor after experiencing a serious health symptom. And so there's work on both ends of the system of the care provision and men's approach to it, the stigma, the fear, the ideas of masculinity that are preventing us from seeking good care. The third quick thing that we found is that men's health affects all of us. There's a really devastating ripple effect on the health of others when it comes to our men's own health. And that comes in the form of caregivers, where 2/3 of caregivers indicated caring for a man with poor physical or mental health was taking a toll on their own mental health. And 50% of those caregivers also said it was affecting their finances. And, the last kind of stat I'll throw out there in the findings is that there's a huge cost to the Canadian economy as well. $12.4 billion a year is available to be reallocated to good things if we improve men's health outcomes. So it's costing us almost $12.5 billion a year for poor men's health. It's all there. The promising stuff is there's good things that are working, and the real challenge, which I hope we can round out with, is we've got to start changing the systems and the policies as well that affect men's health. It can't just be about individual behavior change anymore, and that's where we hope to head with some of this information.
Good stuff.
I mean, obviously that's a lot, and going through the report, there's significant findings, there's powerful stories, there's obviously the depth of the data and the comprehensiveness of it. And I do really love, and I look forward to at the end talking more about, the call to action, like what is actually next. And so that last point is certainly very relevant. But before we get there, our focus is really fathers, and obviously there's a significant impact, ripple effect on families based on what you're sharing. So maybe I'll kick off with a question, and then I'll throw it back to you. But dads often put others first, or kind of put their own health on the back burner. So what does the report reveal about the risks that men face when we actually do that and take put our health on the back seat?
Yeah, there is like a fine balance there, right? Where that provider protector sentiment for dads is powerful. We want to be there, and things that could jeopardize either of those roles for us at times become things that we avoid, or things that we are in denial about, and so forth. So there's a powerful idea around fatherhood that doesn't want to make you seem weak or vulnerable or unable to care for the people that you love, right? The problem is it's like the airplane safety message, right? We've all heard this a million times, but if you don't put your own oxygen mask on first, you can't help other people as well, right? And that comes to both your physical and your mental health. When we are looking in the report about why men do not kind of seek care and why it's not working for them, a lot of these stigmas and barriers start to present themselves. We need to do more work to understand not only which ones are the most impactful and how we can mitigate them, but those ideas of not wanting to seem weak, not wanting to get help, it'll take care of itself, not addressing healthcare symptoms that you might have, are all enmeshed in that idea of being a man and being a father. The hopefulness for me is that there's amazing things that fathers can do to fix this situation, right? There's amazing roles that we can play. One of the things we're hearing from guys is that they didn't have good role models around taking care of their own health. And like, I love my dad to bits, but he's 84 years old and my mom still makes his doctor's appointments, right? So there's things that we can do as fathers to role model better health-seeking behaviors. That has a benefit for everybody. There's things that we can do as practical caregivers for our kids as well. I know you guys have talked about this kind of stuff before, but and I'm sure you've had similar experiences, but I can remember taking my kids to the dentist when they were quite young, and the receptionist looking at me saying, "Where's your wife?" I'm like, "What do you mean, where's my wife?" Like, she's at work and I'm bringing the kids to the dentist. Would you please clean their teeth? And let's outdo these outdated stereotypes, right? So there's lots of amazing things that men as fathers can have roles in there, but we know, and you guys are the experts on this, like when men are active and involved and healthy in their kids' lives, the benefits are there for everybody, including us as fathers, right? I'd love to know your thoughts a bit more on that too, Drew.
Yeah, I mean, absolutely. We definitely know, both from the research as well as just anecdotally from stories, that the more that fathers really do care for themselves, and also why we've aligned with the Men Plus Care, right? We recognize the power and the value of men caring both for themselves and for people who are closest to them, as well as others in the community. And so especially when you look at the relationship, and I love your example of the model, right? You can model health seeking behaviors because that influence, our kids are always watching, right? Our family's always watching, and whether we realize it or not, it has a powerful influence. And so the more that we can model those healthy behaviors, the more that becomes just part of that's what you do. Ed shares a lot about him going to his doctor on a regular basis, right? I mean, what an example of that setting, right? You just eat every 3 months. It's like clockwork, consistent. And why? Because his goal is optimal health and being the best that he could be. And so to me, those are great examples. And I think the number one thing you can do.
Yeah. And we know
Ed?
even like actual health things translate down to your kids as well, whether it's your mental health and wellness or your ability to talk about emotions and problems. Like those are skills that, kids learn by observing, in addition to the making appointments and things like that.
Yeah, absolutely.
Well, it's actually every month, Drew, but I'll take the 3 months. So it's okay. So Todd, let me ask you, what are some of the not good impacts for fathers and men? And maybe you can maybe share some of your own journey of not paying attention to our health.
Yeah, I mean, obviously there's the physical health pieces and just the ability to be active and engaged in your kids' lives. There's, on the tragic and traumatic end of things, there's the premature mortality too, right? Not being around for different things in your kids' lives. We also know that the kind of trauma of losing a dad can be a pretty significant experience, especially in the life of a child, but also in the life of an adult, right? Losing a parent, losing your father is devastating, right? We work with so many people in the Movember community who are participating in this pursuit of good men's health because of the loss of a father, and that's something that has really mobilized a ton of people in our world. There's, in the report, one of the things that we want to do is highlight the different stories that get to the complexity and nuance of men's health, right? We often think when we see a report and a chart and a data like, oh, coronary disease, number one, let's tackle coronary. Well, it's more like there's more complexity and nuance to men's health. So in the front of the report, we feature a story from a Movember community member named Chris out in Vancouver. And, Chris had an experience with testicular cancer when he was fairly young. It was successfully treated. He had a testicle removed. He was trying to think about how to start a family and how that would impact him. And it really, got into his mental health and wellness as well. His dad faced cancer, battled it, got better, battled it again, passed away. That affected his mental health. His own testicular cancer came back. He became a dad. Like, men's health is not just this like silo bar on a graph chart, right? It is this nexus of feelings and relationships and emotions and illness and wellness, and it's all wrapped in there. And when you're a father, it's even more deeply connected because you have that powerful feeling of caring for and providing for somebody and nurturing and bringing other humans into the world, right? So it's added that extra layer on when you're a father, and it's pretty incredible to do. And it's hard. We're all dads. We know like this is like not easy stuff. It's easy to talk about it on a podcast. It's hard to do it in real life. And, the first time is the hardest, and you got to just put your big boy boots on and say, I'm going to go to the doctor and I'm going to talk to my son about it.
Exactly. I love the word you use there, nexus of all these different areas. Just talking about the report, was there anything that you found in the reporting and in the report that you went, wow, I didn't know that?
There were a couple of things, Ed, and I think the one that like drives me almost every day still is there's a lot of stereotypes about men seeking help and seeking care. And it's easy to kind of say, well, men don't ask for help, but the reality is like a lot more complicated and a lot more tragic sometimes than that. And probably the statistic, the data point in this report that got me right in the feels the most was this data point that says, 50% of men who end up completing a suicide did try to access help in the 12-month period before their death. And so, first of all, men are trying to get help, but in some way, for a lot of guys, it's not working for them. And what is behind that? As the gender generally, with more privilege and less inequality to overcome, we don't often think about the gendered nature of healthcare for guys. But this is a stark reminder that we need to do that, and we owe actually a debt to women's health advocates, to LGBTQ health advocates, to understand that there's unique ways we need to tailor services for different populations in order for them to really work. And if we can do anything to bring that number down, first of all, the number of suicides down, but second of all, the more men seeking help when they're in that place and seeking it successfully, then that's one of the shocking things that really drives me every day in the data that we uncovered.
It's good. That's good. Drew?
Yeah, and I appreciate you mentioning that, Todd, because that was an area that I was curious about. It really piqued my attention in the report, talking about the service providers, and you mentioned this idea of customized or tailored more to unique populations.
Thanks for joining us for part 1 of our conversation with Todd Minerson, Country Director for Movember Canada. In this conversation, we've unpacked the big picture of the Real Face of Men's Health report, what's really going on with Men's Health in Canada, what's surprising, and why it matters to all of us. Now, this isn't just about stats. It's about stories, systems, and the ripple effect on families and communities when men aren't well or aren't supported to get well. So be sure to catch part 2, where we dive into what is working in men's health, where the momentum is building, and what it's going to take to turn the tide, from personal action to also public investment. Now, until then, take a moment, check in with yourself and the men in your life. A small step could be the start of something big. So as always on the Dad Central Show, we're happy to have you listening to us. Thank you so much for engaging. And remember, don't just manage your time, manage your energy. Take care and be well. We'll talk to you soon.